Happy to see you once again Saturday. The last case we have finished yesterday, that is 23rd Friday. That is what our 1180 case. So yesterday we have finished 1180 case, that is on 23rd Friday, June 23. So we are almost reaching for 1200 case. I hope we will be able to do it within this month. But today is a very important topic I want to discuss because Puberphonia cases are coming to me and some elder people are coming for treatment with a puberphonic voice. They are already seen by ENT surgeon and suggested they are having phonatory gap, and this is due to the atrophy of the vocal cord, that is thinning of the vocal cord and tiredness of the vocal cord. So few people are asking me, my colleague is there, he is having a tremendous voice, so why not why I lost my voice? My voice is not sounding like that. So similarly, many politicians, many actors, many singers, many orators, they lose their original identity. When I told this matter to my friend Dr. Professor Chandrasekhar from London, he had given very innovative idea. He told me, in olden days, when you get old, your handwriting changes. So, is it any relation to the handwriting and voice? Can we able to prevent it? See, there are so many reasons you are not able to activate your fingers. Olden age, many people have tremors, need not be Parkinsonism. They may be affected with many neurological problems that may create a change in their signature. And he is quoting so many people. And many times even the bankers want to have verification of the signature. When days goes, it changes. So what is the reason for that? Is it possible to have a permanently a same signature? You will be able to do it even in your olden age. So similar action is there for brain and your voice activity. When you are telling few words or singing or your orator or a public speaker, you should have a very bold ionic way of talking. So that ionic way of talking, how you will get it? Yes, you can get it. How? Yes, you can get it very easily. So what is the method by which you can follow and you can get a nice word shaking? So this I have many times with big orators. When they get old, still they will be able to perform that same amount of activity, but few people fails. So what is the reason? What can we do for that? So there is a practical correction for your handwriting. Even in your olden age, you can write legibly if you use each and every word separately. I personally feel you will be able to understand. If when you are writing Tamil word, each word you have to write separately. Any word in Tamil, you have to write separately. There are other language also, but in English, when you write, you have to join together. When we join together, automatically it will be little more fast, and you will try to have so many shape. So you will fail to do correctly what is your aiming. So you have to cultivate a habit. Each word you have to write separately. Each letter you have to write separately. Then your writing will be very legible. Usually it is not there with doctor's signature or even writing the prescription. So this is a continuous channel, so it won't be legible at all. So similar thing affect the voice also. Each word you should have your own limitation. Word by word you have to talk. Then there is no question of in older days you won't be able to talk clearly. That practice should cultivate from younger days. And second point is you should move your jaw frequently when you are talking. Few people are having the habit of talking without opening the mouth. So you won't be able to enjoy their speech at all. So when you want to communicate strongly, you should able to open the mouth. Then only you cannot and they need not have a hoarseness, breathness, or you need not strain your vocal cord, and the rate of your speech also will be appropriate what you are talking. So when you are not able to open the mouth and talk and properly resonate, so you will have a decreased loudness and the voice will be very rough and breathless will be there, and you will be fatigued also very quickly. If you get fatigued quickly, then your words won't be so strong as you are talking frequently. So this also gives an idea how the pitch also change. Many people, they used to orate through the mouth and body. They communicate the voice with the movement of the body, and the voice will come from the throat. That will be a permanent one. But when you are talking, if you strangulate your neck, that means if you use the vocal cord, that will be spoiled very quickly. So this is a fundamental thing. Everybody knows if you are attending some function and shouting, talking, singing, usage of your vocal cord, larynx, strangulating, straining, taking more effort and talk, then definitely after 1 or 2 hours, your voice will be hoarse and it is breathy and it will be strained and it will be fatigued. Finally, you won't be able to talk and the audience also won't be able to enjoy your talk. So this is similar to athletic. When the athletic is going for the decathlon or a marathon race, he cannot have a high speed start. Everything should be measured from the beginning to end. 100-meter dash you can dash, but marathon race you should not strain too much, then you won't be able to finish it at all. We'll enjoy when some people are running marathon, they'll be just jumping and just like a horse, they will go and go on without any tiredness, without any breathless, so without any strain, then only they will be able to reach the goal within that time. So this is a fantastic thing I am able to get from my Puberphonia patients. The interesting note is few of the aged person's voice also will be puberphonic. Puberphonic means they will have a kichikural. Why mean there is a gap in the vocal cord. So we'll try to repair the vocal cord and we are not able to succeed. This has happened in my hands. When we do laryngoplasty, we won't be able to have a 100% success. Even our textbook, great textbook, Scott Brown says in the third edition, puberphonia, there is no indication for surgical management. So this is a word given. So surgical management, operation in the vocal cord is not necessary, and the treatment by surgical maneuver also is not possible. But nowadays, very good surgeons are there and they are giving a positive report, and I really congratulate them. But it is a surgical procedure. We cannot predict the answer immediately. But what happened is, when you inject some local anesthesia and proceed for the surgery, and immediately after the surgery, on the table itself, the puberphonia disappear, because that boy who had undergone a laryngoplasty with local anesthesia, the larynx and vocal cord is paralyzed. So he is not using the vocal cord for talking. What he is using for talking is only the pharyngeal cavity, that where only he resonate the voice and get it. So the voice will be low pitch and puberphonia is treated immediately. This is what my assumption. So I can tell so many examples. Similarly, a hunchback man, a polio man, he had reported to me with a puberphonia voice. And even congenital deafness, they are using hearing aid. They had problem of puberphonia. See, these boys are not using their voice, not using the voice for a long time. They feel they weren't able to do it. They won't have enough strength to do it. If at all they want to have a nice talk, They strangulate the neck. That means they strain the vocal cord and talk. That result in a voice for few minutes, but it cannot be a permanent one. That is what my observation. Similarly, there are a lot of structural deformity in the tongue. For example, tongue tie. So tongue tie, people with puberphonia, don't worry about the tongue tie. If you treat puberphonia by Euler manipulation, they will have a normal voice. It takes example of cleft palate and cleft uvula. There is a gap between the oropharynx and nasopharynx. What will happen? Even though their vocal cords are normal, they won't be able to talk legibly. Their voice are similar to bird only. Birds will also have a cleft subpalate. So the palate is not fused. They will have a free communication between the oral cavity and nasal cavity. And the bird's voice also will be puberphonic. So similar occasion occur in cleft palate boys. So the treatment for that is definitely the cleft palate has to be repaired. It also suggests to you that puberphonia, the uvula is an auxiliary organ for speech. Then what happened to the congenital deaf people with puberphonia? This I had very interesting cases. We had 3 cases of cochlear implant who are puberphonic. Cochlear implant, why they are having puberphonic voice? Their vocal cords are normal. All structures in the oral cavity is normal. Normal movement, normal structure, normal nerve action, but still their voice is puberphonic. Because this is also the inactivation. Puberphonia voice is not produced at the level of vocal cord. This is because of the inactiveness of the uvula and subpalate, where the voice is not resonated as much as possible. So these boys also, we have treated the puberphonia by uvula manipulation, that is the increasing the weight load of the uvula, and they are able to speak normally. So this is a thing, great thing we got it. So similarly, congenital any problem, congenital disease, they may have some problem of even polio in the earlier days. Few are having puberphonia. So all these things suggest to us this puberphonia is not due to the vocal cord structure, but it is only because of the supraglottic vocal tract which is not acting properly and diverting sound, and which is not vibrating. So it is a vibrato problem that I will be able to discuss clearly. This is a lot of things. Where is the vibrato? Vibration comes. That is the low pitch. A drum vibrates. That is the male voice. Bird singing is high pitch. Drum beating is low pitch. A male voice. So similarly, some animals also we can compare. Some musical instrument also we can compare. So all the things where the vocal cord is similar structure is vibrating and producing the sound means it is high pitch. But supraglottic structure, which is resonating and making the sound, which is definitely low pitch and male voice. But all the things we put the blame on the vocal cord from the beginning itself, because vocal cord is a structure for producing the voice. It is the voice box. It only change the frequency. That is already written and proved, and I think we are believing that that's all. So there are a lot of confusion about head voice, neck voice, chest voice, body voice. Confusion is there for us, for me, because we are not trying to accept what is already given in the book. They have their own concept. That is why the new puberphonia researchers, they are giving the topic of puberphonia treatment, the possibility of treating puberphonia. Now one article is published. What are the possibilities available? That's all. When there is so many roads for going for one area means no road is perfect. That's all. Only one road go to that area means that is completely, that road will be good and perfect. So that is what we are telling. The puberphonia treatment, we have to increase the strength of the uvula and resonate that area, the sinuses. So that will give a good result. Possible the correct route of treatment for puberphonia. So besides that, the puberphonia, there are a lot of social problems are there. We are bringing it out now. The second point is the mode of the possibility of good treatment for puberphonia is only the manipulation and the direction what we are how to do it in the supraglottic vocal tract. That is what required in puberphonia treatment, and try to change, not only change, try to have more idea. When the vocal cords are normal in structure, in puberphonia, why? Still we, yes, there is an option is there. We are thinking that the treatment should be done in the vocal cord, because there are some difference between female and male vocal cord. Still we are thinking like that, and so we are not able to digest or accept any change in the concept of treatment of puberphonia. That's what we are strongly suggesting, that a new concept, new idea, new uh, physical changes, or what are the changes that we can have happen in the supravocal tract, supraglottic area, that changes the frequency, which gives a good voice to a human being, should be appreciated, and this should come to the light in due course. That time everybody will have the feeling that treatment for puberphonia can be done without any surgical intervention in the vocal cord, where the uh, result you won't able to predict. So thank you very much for you. We are very happy on this Saturday, 24th uh, June 2023, because yesterday, 23rd June 2026, we have finished 1,180 cases of puberphonia, and hope to see you next Saturday with a different topic. Thank you and great happy sir.